So what we have hopefully been listening for and getting a grasp upon through your training prior to this point is this concept of looking for the health in the system and not being so focused on disease or dis-ease and pain, but what does it feel like to discover the health in the system? What you're hoping to maybe experience is that at the center of this field, and here's the illustration, you are aware of fluid movements and the power or the potency that this person is capable of projecting or holding at this point. And could you sense this inertial force, this inertial potency within the inertial fulcrum itself? Now, this is a deep concept, and it gives you something to tune yourself and listen to see if this inertial tissue, these inertial fluids, may have changed somewhat just by you becoming aware and having your hands in that particular position at that particular vertebrae where you're sensing an inertial fulcrum. And do you feel an expressional change? Is there a difference? Are you aware of the potency? And if not, it's okay. It's something to focus on. It is meditation. And when the mind is wandering, bring your mind back to your own practitioner fulcrum and breathe and use the imagery of the training to allow you to deepen your meditative focus as a human being and to enjoy the study of stillness. That's what this is all about. The transformation of you as a human being, and as you transform yourself, your ability to help people without being attached is profound. So, did something resolve itself? Could you possibly feel like a realigning at the midline? Was there a sense of cohesion or coherence that changed a little bit? Again, just allow this, to occur around this axis, and it may take some time to do that, and it may not even happen in this session, or it may happen very quickly. Just become aware of the midline and the phenomenon that made you come to this particular place, and how the system will prioritize where it needs you to be, not where you need it to be. And that's this whole concept of the biodynamic model, is that the system is going to prioritize and lead you to where it needs to be, where it needs to have your hands, where it needs to have your focus, where the particular inertial fulcrum needs to dissipate. So that, we call this the inherent treatment plan, and that was Dr. Becker's vocabulary, is that the body knows what it needs, and that inherent protocol treatment plan around this particular vertebrae or vertebraes is where you need to go, because it's taking you there first, because it needs to dissipate and balance that before potentially deeper issues that may be causing some of the pain syndrome or issues, emotional or whatever, that has brought this person to your table in the incipients. You can take what you've learned in this particular session and renew your history with the work by going to your spinal-basilar joint, going to your Sutherland's fulcrum, going to your occipital, dural tube, anything that you have learned in the past, you can now meld with what you're going to be doing in the spinal column. Okay, so we're going to move on from here.